But we're starting our Wednesday like we have every Wednesday for the past couple of months. We're welcoming in a doctor from OrthoVirginia. Today, it's Dr. Andrew Bogle, former Richmond Spider and current surgeon over there at OrthoVirginia. Doctor, how are you doing on this wonderful Wednesday?
I'm doing very well. Thank you for having me.
Yeah, of course. I want to start here with your experience playing with the Spiders, right? How did you balance a football schedule along with what I imagine was a pretty difficult kind of pre-med track?
Well, it certainly took a lot of preparation and dedication, but I kind of said I had a double major in football and biology because they certainly had to prioritize both of those things in order to make them both work.
And throughout your entire football playing career, was there anything specific that wanted to get you into this line of work? Was it something that happened in football, or was it something you always just had a passion for?
I was always interested in being a physician, even when I was a young person, and growing up playing sports in high school and college. I got really interested in the anatomy that you learn about in orthopedic surgery, muscles, bones, tendons, that type of thing. And you certainly learn a lot about those things trying to develop as an athlete. And then you see injuries, and I said, gosh, that's a good fit for me. So
that's awesome. Dr. Andrew Bogle from OrthoVirginia joining us on this Wednesday morning. And now today, here we are. How does your time as a college football athlete help you as a team physician and orthopedic surgeon who does treat athletes?
Sure. Well, that's one thing that I really have enjoyed with my practice is taking care of athletes, helping take care of Richmond, but also just athletes in the community. And I think you understand their goals. When you're a former athlete, you understand wanting to get them back as quickly as you can in a safe way that still, recognizes their priority of getting back on the field or on the court by still taking care of them appropriately to protect their injuries and keep them safe.
That makes a lot of sense. How'd you end up getting involved with Richmond post-grad?
Well, interesting. So this is actually a funny story. When I was a college football player, my former partner, Dr. Christopher Young, was the team doctor for the Spiders, and I used to watch him when I was warming up before the games, watching him catching punts and things. And I said, gosh, that would be really neat to do that someday. And ultimately, I joined OrthoVirginia, which is his practice. But when I was a player, Coach Reed, who was my coach at the time, apparently told Dr. Young, he said, Andrew Bogle is going to come take your job someday. And Dr. Young loves telling that story because he's retired, and I kind of have done so, which has been a neat little story. So
that's awesome. You can see the future then. That's pretty cool. I do want to talk a little bit about some of the injury news that is happening around the NFL. And of course, you're not working directly with these athletes, anything like that, but just providing your expertise. And we've seen a lot of news about hands, right? Like Justin Herbert broke his left hand, non-throwing hand. Aaron Rodgers is dealing with a wrist injury on his non-throwing hand. And we always see these reports have non-throwing hand be they really hammer that home. And I mean, it makes sense. It's the hand that they're not throwing with. So it makes sense that maybe they can play with it. But I'd love to know from your area of expertise, when it comes to a quarterback who is dealing with a non-throwing hand injury, how that could potentially impact their play on the field.
Sure. I mean, the question is, a lot of times you can throw and you can play when you have an injury, but the question with returning to play is, can you play at a high level? And I think certainly people at the elite level of Aaron Rodgers, Justin Herbert, those guys can get by with some bumps and bruises. But when you do lose strength in your hand, when you have an injury, that really makes you worry about ball security, in particular when you're talking about a quarterback and just feeling comfortable taking hits. And those guys certainly can do it. But I think the risk is if they were to have an injury or a big bump or bruise or, knock, they might not control the ball as well as they would had they not had that other injury.
And another injury, and again, you're just providing your expertise on this, but another injury that we saw recently was Jaden Daniels and his elbow, where it was a dislocation, which feels like he avoided the worst case scenario. But how much of and I apologize for the pun here, how much of a lucky break was it that it ended up being just a dislocation for Jaden Daniels with that injury on his elbow rather than something more serious?
Yes, certainly that when you see that injury on the field and you see that deformity, it's kind of a scary thing to see. But thank goodness he had what it sounds like is a bony dislocation without a fracture to the bones or meaningful structural ligament injury. And that's, certainly dodging a bullet, because those things, there's a similar injury that when I saw his arm, there's an injury called the terrible triad, and they don't call it that because it's an easy injury to recover from. that I was certainly worried about when I saw that, but thank goodness it was a stable dislocation, and hopefully he'll be able to get back safely in the near future.
And with you playing on the defensive line, and you had a good amount of success with the Spiders as well, I was looking up some of the stats I could find, and some good TFL numbers back there. You were making your presence known along the defensive line. But in the trenches, you must have seen some gnarly hand injuries kind of up close and personal with what's going on in there. What are some injuries, specifically hand injuries, maybe wrist, things of that sort, that are common among trench players?
Sure. Well, a lot of hand-to-hand combat on the inside, and a lot of broken hands, broken fingers, broken wrist. And there are some particular tendon and ligament injuries that are also very common in the hand and wrist, with a lot of the, up close and personal action you get on the front, in the front seven. So.
And did you suffer any kind of bad injuries during your time as a defensive lineman?
I did. I broke a couple of fingers. I had a tendon injury to my hand. I had a fourth metacarpal shaft fracture that required surgery by another one of my now partners, which is kind of a fun thing to remember. But, they all, thankfully, I was treated very well, and they all did very well. And the only time I really remember them is when I'm trying to talk to a patient and say, see, I had this scar too. So people can get back and do well despite having an injury like this.
Dr. Andrew Bogle from OrthoVirginia joining us this Wednesday morning, and we've spent a lot of time talking about athletes, injuries to athletes, but I'd love to know, how often do you treat people with non-sports related injuries?
Oh, sure. So, like I said, when I was playing and I saw Dr. Young catching punts and taking care of the Spiders, I kind of thought, man, that must be all he does, and takes care just takes care of athletes and catches punts. But no, the vast majority of my patients are regular folks who have other jobs other than being dedicated athletes, or they just have athletic interests on the sides. But, that's a neat thing about doing what I do, is you take care of little kids who have injuries all the way up to workers who have terrible injuries at work, or older folks who have degenerative things that need attention as well. So you get a very wide spectrum of experience taking care of hand, wrist, and elbow things.
And you're located in the Westchester office for OrthoVirginia. And what makes that new Westchester office state-of-the-art, a state-of-the-art orthopedic clinic?
Well, I think it's just the concentration of things we have here in the building. So we have a wide array of physicians taking care of the whole spectrum of orthopedic problems. But then we also have, in addition to having the physicians on site, we have hand therapy on site, we have physical therapy on site, we have a pain center on site for people who need procedures that are done for pain, chronic pain, that are non-surgical, so we have that capacity too. And then the other kind of really exciting thing is we have an on-site surgery center that can take care of all orthopedic problems that don't require an overnight stay in the hospital. So everything from ACLs, rotator cuffs, carpal tunnels, things like that. But even the newer things that we're doing now that are on the cutting edge, I would say, are the total joints on an outpatient basis, spine surgeries on the outpatient basis. So those are the things that make it kind of unique and exciting. And it's a big center, good location. It's I think, exciting place to be.
And where can listeners go to schedule an appointment with you all at OrthoVirginia if something hurts?
Just www.orthovirginia.com, and there you can schedule online, or you can, research physicians you might want to reach out to. But it's a neat process they have with MyChart. The patients can interact with the teams directly, kind of getting around the phone system, which makes it a little bit more direct and often works very well.
Awesome. Dr. Bogle, appreciate your time on this Wednesday morning. Have a great rest of your week, and thank you so much.
Of course. Thanks for having me.